भाई नहीं था एग्जिट चालू થશે એટલા વાગે गीत तो डॉक्टर 3 मिनिट बाकी है चालू कर दूं वांधो नहीं करो गीत तो जाओ શું તો પછી મતલબ ને કેમ તારો વોઇસ ક્યાં ગયો રિફ્રેશ બંધ થઈ ગયું વાંધો નહીં માઇક્રોફોન લગાવવો પડશે તો પછી ગીતામાં જ રહેવા દે આપણે એનાઉન્સ નથી કરવું બરાબર બરાબર ગીત વગાડી જાવ
हे समस्त रीति कृषि मूलम धन धान्य औषधि संपन्नम हे समस्त रीति कृषि मूलम धन धान्य औषधि संपन्नम कृषि संस्कृति जनमंगलम कृषिकार्यश आयुर्बलम हे समस्त रीति कृषि मूलम धन धान्य औषधि संपन्नम दक्षिण गाथा गुर्जरी गिरिकुंजवन सृष्टि भरी दक्षिण गाथा गुर्जरी गिरिकुंजवन सृष्टि भरी भूमि स्नेह शीतल साक्षरी भूमि स्नेह शीतल साक्षरी सागर सुमन सरिता भरी हे समस्त रीति कृषि मूलम धन धान्य औषधि संपन्नम रंध्राण उद्वाड़ा स्मृति जरथोष्ट्र आतश संस्कृति उबराट तीथल आहवा और डांग डुम्मस वेड़ छी समस्त रीति कृषि मूलम धन धान्य औषधि संपन्नम मुंशी मिठू मोरार जी दादा रतन कल्याण जी कंदेल डांगी खारवा हलपति अनाबिल पारसी समस्त रीति कृषि मूलम धन धान्य औषधि संपन्नम गांधी नमक सत्याग्रही गांधी गिरा गरुड़ेश्वरी गांधी नमक सत्याग्रही गांधी गिरा गरुड़ेश्वरी सरदार सरोवर नर्मदा सरदार सरोवर नर्मदा हे कंकरा सब शंकरा हे कंकरा सब शंकरा हे समस्त रीति कृषि मूलम धन धान्य औषधि संपन्नम धन धान्य औषधि संपन्नम धन धान्य औषधि संपन्नम
Means inside out of diaphragmatic hernia, right from the diagnosis and various approaches of the surgical management. And also the diaphragmatic hernia was a great challenge once upon a time, but because of the constant efforts, commitment and dedication, the team of the SDUS Canada Department of the Surgery, they have mastered the surgical approach management of the diaphragmatic hernia. And as far as I know, the recovery from diaphragmatic hernia is too high as comparable to the leading institute of our country. And I want to say to the students. I want to say a few words to the students who are part and parcel of the Department of Surgery of Gujarat or any other state of the country. That diaphragmatic hernia is a biggest challenge as far as the large animal surgeon is concerned, and it is one of the greatest problem which occurs around parturition. And many doctors, particular field veterinarians, are not able to diagnose the condition, and different the therapeutic modalities, different therapeutic enzymes are adopted and applied to the animal, and it makes unnecessary expenses, and that too without any result. So at least diagnosis of the diaphragmatic hernia and communication to the owner that there is, if you wish, there is only one thing, that is the surgical approach. If you wish to otherwise, there will be the wastage of the money and time. So this is very, very important. So I expect the students, maybe the undergraduate student, maybe the postgraduate student of the faculty member of Department of the Surgery, kindly just pay attention to the Prajwalita, who will be speaking on the diagnosis and management of the diaphragmatic hernia. She will cover almost all the points. She is a very good surgeon and committed surgeon. And as far as once again, I said the large animal surgery is concerned, she knows how to handle it. So she is very, very confident young lady, and I wish her all the best, and thank Dr. Deepak Sudhar and Dr. Lalit Modi for organizing such a beautiful, wonderful webinar on the diaphragmatic hernia and benefiting the students. And once again, I assure you, particularly the organizations and speaker, as and when you wish any support from NAU Navsari, we will be happy to help you. Anytime you are most welcome for benefit of the surgery, for benefiting the students, for benefiting the surgery, for benefiting the poor animals, and benefiting our novel veterinary profession. So best wishes and thanks to all of you. And as far as the participants are concerned, I wish as and when our faculty members they come with any proposal of the webinar or any other thing, I wish you join hands with the faculty of NAU Navsari. And once again, I thank you all. Jai Hind, Jai Jai, Garvi Gujarat, Jai Hind. Thank you.
Thank you very much, sir. So let's start our today's webinar. I request Dr. Prajwalita, please start the webinar. Dr. Prajwalita. Dr. Prajwalita.
हेलो
हाँ जी, ओके ओके,
हेलो
Prajwalita.
चालू करो, चलो आवाज आ गई,
यू आर नाउ अनम्यूटेड
ओके,
Prajwalita.
हेलो
हाँ सब
यस सर Yes, sir.
You are audible. Huh? Please.
यस ओके प्लीज
Your name is Praju, I think.
प्रज्वलिता सर
Okay. Miss. Okay.
नहीं करता नहीं,
Okay.
Yes, yes.
Please start the webinar.
Okay, yes, sir. Dr. S.R. Chaudhary, sir, Honorable Vice Chancellor of Navsari Agricultural University, Dr. B.B. Khatradi, sir, Dean and Principal of College of Veterinary Science, Navsari Agricultural University, Dr. D.N. Sudhar, Organizing Secretary of the Webinar Series, and Dr. Lalit Modi, Co-Organizing Secretary of these webinar series. Thank you very much. Very good morning to all of you all, senior colleagues, and my dear friends. A very good morning to all of you all. Sorry for the initial glitch in joining. I'm very thankful to Navsari Agricultural University as well as to the organizing secretaries for giving me this opportunity to speak on DH. Diaphragmatic hernia is very dear to me, not only because we get a lot of cases at our department here, but also because we have the plan scheme. As Chaudhary sir lightly said, he's been my Guruji and teacher when I was a student here. Thank you, sir, for those wonderful words. To start with diaphragmatic hernia, next please. Next please. Next please. Can you change the slide please, or should I? Yes. Okay. Yes. Now, diaphragmatic hernia, it is divided, or I have divided my talk for today into these broad headings, and I would cover them one by one, moving towards what is diaphragmatic hernia. Next, please. Next, please. Now, we know it is diaphragmatic hernia, it is an internal hernia. It is so because it is hernia occurs from when the organ breaks the diaphragm and it enters from abdominal cavity and reaches the thoracic cavity. Now, against the normal hernias where there is a sac, there is a hernial, there are hernial content. In case of DH, being an internal hernia, there is no sac. The organ itself tears the diaphragm and enters the thorax. Now, this diaphragmatic hernia, it is a disorder which is causing a lot of economic loss to the dairy industry. And being an internal hernia, it is difficult to diagnose. But I would say no, it is easy to diagnose if you know few basic things. And when we think about treating any disease, the most important is the diagnosis, right? Now, the way we are dealing with the COVID situation here, and the diagnosis of the infection is a main to for mitigation and treatment. Similarly, for DH, we need to diagnose it in an early phase. And once it is diagnosed in an early phase, we can bring the animal back to its production level. We can make sure that the life of the animal is maintained, and we can bring it back to its production level, causing a lot of saving the loss, because many owners come to us telling us that the hernia is being for many months and it is not being diagnosed. Using very few and simple pointers, each one of us can diagnose this disease as well as operate it. Next, please. Next, please. Yes. Now, yes. Can you see? This is just a graphical representation of what I was talking about. The ruminant forestomach, and the other organs of the abdominal cavity, it will move inside the thoracic cavity through a break in the diaphragm. Now, this break in diaphragm would cause these organs to move inside the thoracic cavity, and we need to diagnose this, in an early phase, and get these organs back inside the abdominal cavity, and suture this rent that has occurred. Next, please. Now, this is something to get the picture in our head clear, because when we perform DH, or many few people can see what is happening inside, because it is done totally blind. We put our hands inside through the incision and everything is done. Our fingers see, but the students who are standing outside, or no other person can know what is happening inside. That is why I'm showing these post-mortem pictures. This buffalo presented to our clinics, and it was showing a lot of respiratory distress and a lot of regurgitation. And immediately it reached our clinic and it just collapsed. Now, when a PM was done, can you see this? This is the rumen here, and this is the adhesions that is attaching the herniated reticulum, which is going inside the thoracic. Can you see? These are the cut ribs here. These are the ribs here. So this is a diaphragmatic hernia. And when this thing was transected from here, can you see this? You can see this is the the recumbency of the animal, and can you appreciate the honeycomb-like structures which are present inside? This is a reticulum, because we have just transected it from here, and you can appreciate the honeycomb structures which are of the reticulum here. So this is to get stamp what is DH in our mind. Next, please. Now, thing that comes to our mind is what causes DH. Now, anything that increases the abdominal pressure, like carving or a sudden fall, or it could be due to a congenital weakness of the diaphragm. Now, or it could be a foreign body. Now, I have shown you in the previous slide how close the reticulum is to the diaphragm. So any foreign body, because we all know reticulum catches foreign bodies because of its honeycomb-like structures, right? So it will capture these foreign bodies, and these accumulated foreign bodies will pinch on the reticulum. This continuous pinching will cause that reticulitis, and if it goes further, it will not only cause traumatic reticuloperitonitis, but it might also puncture the diaphragm. Now, numerous studies have suggested that these foreign bodies are also one of the main etiologies. Now, it is not that each one of these etiologies occur alone. No, it might be so that the animal is having a foreign body, and it is during carving as the abdominal pressure increases, or when the animal suddenly falls. That would cause a pressure on the diaphragm and causing a rupture, right? It might be also so that a foreign body which has created a small rent or a small hole in the diaphragm, it might worsen during a fall or tympany, acute tympany, or in case of carving, when increased, or in case of dystochias, or even normal carvings. Now, can you appreciate that I have shown you a picture of the diaphragm? Now, this is the peripheral, is a muscular area of the diaphragm, and centrally is a tendinous area. Now, according to the literature that we have reviewed, or even our practice, what we find is this diaphragm, it tears mostly at the musculotendinous junction. As I always tell my students, see, whenever the clothes tear, most commonly they tear from the stitches. The same thing happens here. So this reticulum, it is a joint. The diaphragm has a joining portion, that is the muscular and the tendinous portion, this portion. Now, whenever this is a weak point, right? Any joint is a weak point. We all know that. So this reticulum, the diaphragm, it tears or ruptures from this joint, and the abdominal viscera will prolapse into the, or not prolapse, or it would move or translocate into the thorax, resulting into diaphragmatic hernia. Now, many people say that it might be having a congenital origins. Now, there are many reports that newborn calves, they suffer from hernias, right? Diaphragmatic hernias. There is numerous reports abroad as well as in India. Although this does occur, but the incidence is much less. Most commonly, we see that the buffaloes, or even the bovines we have seen few cases in HF crosses and others, but it does occur in HF cross also, and other cows also, and that is why the topic I choose as bovines. Now, many scientists feel that the wallowing habit of the buffalo might also predispose these buffaloes to buffaloes more than cattle. Next, please. Yes, as I said, the incidence is more in case of buffaloes, and especially those buffaloes which are towards the later part of the parity, towards the later life, not the young heifers. But we have found that even young heifers are affected, yes, definitely less than the older age animals. But buffaloes per se are more affected than cattle. Now, many researchers feel that the diaphragm in buffaloes is thinner as compared to cattle, or there are a lot of theories, but so far, exactly there is no pinpointed etiology confirmed of DH. There might be a number of environmental factors. People are also hinting towards the hereditary factors, but looking towards the devastation that this disease is causing to the dairy industry, we need to investigate what are these etiologies of this diaphragmatic hernia. Now, 2 lectures back, Dr. Chaudhary had said, see, as we breed these animals for high production, it might be possible that these hereditary defects might be accumulating over the generations, and that might be one of the cause of DH, right? So we cannot look out, or we cannot negate the environmental findings in etiology of DH. Next, please. Next, please. Right. Now, very important to note is what are the clinical signs that you see in buffaloes or bovines with DH. Now, most common sign that we see is combined with history of recent calving, we see recurrent tympany as one of the major signs of DH. Can you see this hide and bone condition, total lean body scores. So these animals, they suffer from progressive emaciation, there is weakness, these animals are dehydrated, and in advanced cases as regurgitation. Can you see, this is a hot iron branding that many people, it is a common practice in the farms, right? Many people think that if you do that, it show any recovery, but no. This is one of the malpractice that we find that most commonly is in DH, because recurrent tympany occurs in these animals. And also, next please. See, can you appreciate the regurgitation? Animal is regurgitating from the mouth, from the nose, because the ingesta is continuously accumulating inside the rumen, and it is not getting emptied. As it is not getting emptied, it causes a pressure on the esophageal groove and causes opens, and all the ingesta will come out from the nose, as well as causing aspiratory pneumonia. Now, this is not a very good sign when we deal with DH, because when you see such a sign, and if you diagnose that animal, with the DH, then you know this animal is end stage, because there might be complications of pneumonia and other stuffs. Now, can you see these eyes? They're sunken in because of this dehydration. Now, if you appreciate these abducted elbows here in this case of animal. Now, because many times when there's a foreign body, it might cause, TRP combined with DH, then we see these kind of symptoms. Next, please. Next, please. Okay. So this is, as I said, this is the general overview that I have divided. Next, please, for diagnosis. Now, coming towards ultrasound. Now, for ultrasound, we should know one basic principle, that we have the machine and you have your ultrasound transducer. Now, this transducer acts like the ears as well as the the eyes of ultrasound machine, because it sends out sound waves inside the body of the animal. And these sound waves, when they're reflected, we see images on the screen in the form of dots in case of B mode. You can see a bright image, you can see a B mode real-time image, you can see. Now, we use B mode most commonly. M mode was used previously, but nowadays mostly we use B mode ultrasound for diagnosis. Now, as I said, in case of ultrasound, in case of B mode, each dot corresponds to one echo. And if there is floor, it will appear black, that is anechoic. If there's a soft tissue, hypo, and if there's air or bone, it is hyperechoic. We are very familiar with that. Now, just look at the location of the transducer. You have to keep the probe or the transducer in between the ribs, right? That is the intercostal space. Now, we know reticulum extends up till the 6th or the 7th intercostal space. Beyond that, you will enter the thorax, that is heart, you will visualize. So, we shave the area, prepare it, shave it, and apply ultrasound gel. Now, what if you do not have ultrasound gel? Don't worry, you can use rubbing alcohol, or you can even use paraffin on the skin. That gives a good, acoustic medium, and you can perform the ultrasound. Now, what if you don't have an ultrasound machine? What if you're at field condition at the owner's doorstep? I know many field veterinarians who diagnose DH just using a stethoscope. We diagnose DH using a stethoscope. It is not that you definitely need an ultrasound machine to diagnose. No, you can do it very clearly using a stethoscope. The reason I didn't put the picture of auscultation, because I cannot show you the sound that we can hear. Typically, you will see a gurgling sound. The movement of that sound, that is the sound of the reticular motility. Exact same place where you put your probe for visualizing the ring, same order for visualizing the reticulum, same place you have to put your stethoscope. And the trick is, wait there, don't be impatient. What I do is, I will hear the reticulum, the normal reticular motility at the 6th or the 7th intercostal space, which is just normal area where you will find in each and every animal, you will get a reticular motility. Now, my friends, you have to be patient. You have to wait there for 3 minutes, adjust your stethoscope so that you can get only the internal sounds and no sounds of the rub or the skin movement that the animals get. So wait patiently, hear the reticular motility sound inside the abdomen. Then slide your diaphragm on the 5th intercostal space. First you are at 6th, then slide it on the 5th intercostal space. Again, try to hear the same reticular motility sound. You have to wait for 3 minutes and you will get a gurgling sound, right? Along with that, you will hear that there is no hard sounds. Now, when hard sounds get muffled, the reason is because reticulum will move in between the heart and the abdominal wall. Now, this will cause, the hard sounds to get muffled, or they will be suppressed. And then you can, again make the animal. What we do is we tell the owner to tie a rope, tie a small snare to the limb just below the fetlock, and just above the hoof, and just